the global population? That's the question.
Cases of respiratory illnesses have been surging in northern China, particularly among children. It has sparked speculation of a new pandemic threat 4 years after COVID 19 first emerged in the country. Keeping a firm tab on the developments, the Indian government has initiated a review of the preparedness measures. At least 6 Indian states are on alert: Rajasthan, Karnataka, Gujarat, Uttarakhand, Haryana, and Tamil Nadu. Now, the reports of a spike in pneumonia cases in China are similar to early reports of a mystery pneumonia outbreak back in 2019 in Wuhan, which heralded the emergence of COVID 19, and that is why this is creating a scare once again now that we are in 2023. 3 districts of the Indian state of Uttarakhand share land borders with China. The state has directed officials to step up surveillance. The Indian state of Karnataka has also put its healthcare infrastructure on alert. At least 4 other Indian states are also on alert here. Last week, the World Health Organization requested more information from China about children suffering from undiagnosed pneumonia. The WHO repeatedly criticized Beijing for a lack of transparency throughout the COVID pandemic. Some observers speculate the outbreak could be caused by Mycoplasma pneumoniae, commonly known as walking pneumonia. Mycoplasma pneumoniae mostly causes a chest cold. Symptoms include sore throat, fatigue, and a slowly worsening cough that can last for weeks or sometimes even months. The prolonged illness and the risk of pneumonia is what's alarming parents. Chinese authorities have attributed the rising cases to the end of COVID restrictions and the arrival of the cold season. The winters are here. They are also citing the circulation of known pathogens, including influenza, respiratory syncytial virus, and the virus that causes COVID. Worryingly, it isn't just China. In Europe, the Netherlands is also experiencing a bizarre uptick in pneumonia cases. And again, these pneumonia cases are similar to the ones being seen in northern China, as they are affecting children primarily, marking the second country to report an outbreak of this type. As per reports, the Netherlands Institute for Health Services research stated that 80 of every 100,000 children between ages 5 and 14 suffered pneumonia last week. A news outlet said even the National Institute for Public Health and the Environment, which is essentially the Dutch equivalent of the US CDC, could not give an explanation to this. Beijing's opacity and recent policy measures have added to the alarm. Now, China will temporarily exempt citizens of France, Germany, Italy, Netherlands, Spain, and Malaysia from needing visas to visit the world's second largest economy. From the 1st of December to 30th November next year, citizens of those countries entering China for business, tourism, visiting relatives and friends, or transiting for no more than 15 days will not need a visa. The move is aimed at boosting post-pandemic tourism. But with concerns over undiagnosed pneumonia outbreak, is Beijing once again looking the other way and endangering the global population?
In China, there has been a spike in cases of pneumonia in children. China says the surge is linked to circulation of several types of pathogens, mainly influenza. But this wave of pneumonia outbreak, it has the world on edge, and for good reason. It's brought back memories of the mystery pneumonia outbreak back in 2019 in Wuhan, one that later came to be recognized as the harbinger of the COVID-19 pandemic. So understandably, this wave has raised concerns, and the fact that the Netherlands too reported cases of pneumonia in children soon after does not inspire much confidence. And in light of this, New Delhi is leaving no stone unturned to be better prepared this time around. Several states, in a proactive approach, are overhauling their medical infrastructure to ensure better surveillance and preparedness. As is the case with China, always there appears to be a lack of transparency with regards to this outbreak. My name is Hema Kaur. To discuss this, we have with us Dr. Vivek Nangia, Chief of Pulmonology, Critical Care, Max Healthcare India. Thank you so much for joining us, Doctor.
Thank you.
Now, Doctor, to begin with, the spike in pneumonia cases in China, do you see this as an ominous sign, especially since there were also reports of a surge in pneumonia cases from the Netherlands?
Actually, going back into history, in 2019 also China started like this, only giving us only some information about the pneumonia, not the complete one. And the significant part here is again that we don't know what virus or bacteria is causing it. Of course, they have attributed it to a series of bacteria like Mycoplasma pneumoniae, then some viruses like influenza, COVID. But are they all different etiological agents, or is it one common agent and then these are being secondarily isolated? We still don't know. So I don't think we have the complete information with us yet. So we just need to be very careful about it and keep watching it very, very carefully.
Absolutely. So, in fact, I was going to come to this. Information on what sparked this wave of illnesses, that is scant. China blames it on circulation virus pathogens simultaneously. Of course, this brings back memories of the outbreak back in 2019, as you mentioned as well. What's your assessment of how this might play out?
So it is really very difficult to say. See, what happens is whenever there is an outbreak like this, there are two things that we need to keep in mind. That the outbreak usually happens when people do not have a good immunity towards the virus, and that usually happens when it's a new onset virus. So we're just hoping that there is no new bug that has got created. There was also a rumor in between that there's an H9N2 being attributed to it. H9N2 is a kind of an influenza virus which also has its origin in the animals, in the poultry basically. So again, if there is a recombination of some kind of a strain in the poultry and then spilled over into humans, then there is always a risk of it spreading rapidly. So two things, as I said, which are important for us to note are whenever there's an outbreak, it has to be some new virus which has come into the environment, into our the environment around us. And second is that we have no exposure to that kind of an immunity. As a result, we are facing the brunt of this illness.
Yeah, there's a situation here in Barbados where they're saying respiratory illnesses are rising, and you should wash your hands more, and if you can, wear your mask, etc. So I know if this is repeated 2019. It's surely looking so, but they're not Bill Gates say the next one will get their attention. That's what he said. So this is December the 2nd, 2023. So let me see what will happen between now and next year. Yeah, that's why it started in 2019. It started in 2019. It take around November. So yeah, could this be it, boy? Could this be it?
In the society. One is that. Second thing that I would want to strongly recommend to everybody is that as soon as you come down with a cold and cough, you should isolate yourself. Irrespective of it's a common cold you feel or it's an allergy, because ultimately this is our social responsibility towards the people around us, towards our loved ones, towards our family, our colleagues. Isolating yourself till your acute phase is over is very, very essential, whatever it may be. For somebody who's healthy, it may just be a mild infection. But somebody who is in immunocompromised state or elderly or has been under chemotherapy on steroids or those kind of medicine which suppress your immunity, in them even a mild infection can turn out to be very severe and life-threatening. Third is that I think we should go back to our social distancing, going to overcrowded places. Avoiding parties, large gatherings. Fourth is that we should follow cough etiquette. So even if you have a mild cough, you should always cough in your arm, in your sleeve, and not openly without any hanky or a tissue paper with you. And of course, the highly vulnerable group, that is the elders, the youngsters, as in 5 years of age, those who are suffering with any comorbidity should also be getting the influenza vaccine, which will prevent you from catching this common cold.
All right. Now, of course,
just like 2019, boy. So we heading for another lockdown. Boy. We heading for another lockdown.
From the stranglehold of COVID-19.
See, whatever we may say or do, if there's a surge like COVID-19, then again, we can never be prepared for it. Whatever preparation we may put into place, you can never be prepared for it. Like even in India, if you remember in the initial part 2020 beginning, we were quite all right with the kind of number of cases that were happening. But then suddenly in April 2021, there was a Delta wave which came, which devastated all of us completely. So you can never really be prepared. Despite all your preparation, the devastation can be huge. But yes, we are definitely better off than we were then.
Right. Now, of course, the WHO too has demanded more information on this outbreak. How do you see this playing out in that regard? What I mean by this is, what sort of information are we looking at here, and how would that help?
So basically, I think WHO needs to play a greater role now. get the exact information as to what virus or what bacteria or what pathogen is really circulating. It is most likely some kind of virus only because bacterial infections usually don't spread so rapidly. Second is that they have to ensure that there is adequate control measures being taken in China to control the spread of the infection to other parts of China and other parts of the world as well. So these are the two things that they need to be actively involved in and be able to caution all of us as to what next we can do to prevent this from coming into our country.
All right. Well, Dr. Nangia, thank you so much for joining us on Beyond with your